Vista Apex Solutions has been a pioneer in the endodontic solutions product line. They were one of the first to introduce proprietary branded endodontic solutions that you knew you could count on because they had quality controls, they were FDA approved, and they have expiration dates. Well, now they've combined that solution technology with a color-coded syringe system. This allows you and your teammate to always know exactly what you have in the syringe before inserting it into the tooth. So with your sodium hypochlorite and your chlor extra, they've color-coded that as red. And that should bring an alarm because this is the most caustic and dangerous solution that we use in terms of its ability to cause any type of damage, burn, etc. for the patient. As you see, I have the orange Voyager tip, the VIP tip, which is a great tip to be able to dispense this into the canal. It's double ported, side ported, and it allows for safe administration of the solutions. We also have the EDTA and smear off. These come with a blue coating, so you recognize immediately this is going to be used in your final irrigation protocol. You know that you have EDTA, which is for the inorganic debris removal. The smear off is an inclusion of surfactant, which allows a little bit of easier penetration into the dental tubules. And lastly, the Endo Sealer solvent. This is new to the market. The first ever solvent that using a citric acid and surfactant-based blend, proprietary, so I don't know the exact composition, allows you to adequately and effectively take away that bioceramic material from inside the canal space. This also works extremely well with calcium hydroxide. This is color-coded as yellow. So between the red, the blue, and the yellow, you and your team can really communicate well with each other. And from a training perspective, it allows your assistant to feel more comfortable with these various solutions that you're using. So let's talk a little bit more about the Endo Sealer solvent. I want to say that in the early days of bioceramic obturation, a lot of the bioceramic material was very bulky within the canal. You had a small cone and a large bulk of the cement. Well, trying to retreat these cases is extremely challenging. So as you can see in this video, you'll be able to see how this material is actually able to break down that bioceramic material quite easily. And you can see that with comparison to some of the other materials out there. So you can use this with agitation, whether it's ultrasonic, whether you're using some type of laser technology. The agitation of the solution is very helpful in helping to facilitate the removal of the bioceramic material. So this product line of EDTA, both with and without surfactant, and the smear off also has a chlorhexidine insert in it. Whether you're using the sodium hypochlorite or the chlor extra, again with surfactant to help penetration. I like to use surfactant in my cases. You have a color-coded system of proprietary blends that you know you can count on because there's nothing worse than using a sodium hypochlorite product, and that sodium hypochlorite has actually been affected, it's been contaminated, it's been weakened, and you won't know that by smelling it or seeing if it bleaches your scrubs. Free chlorine ion is the key element to make sure that your sodium hypochlorite products are actually being able to fight off that biofilm, dissolve tissue. And so I always want to use a proprietary brand like Vista Apex Solutions offerings here to be able to assure that when I place the solution into the tooth, it's effective and going to help my patient to be able to heal. So this solution line is incredible. I'm really enjoying these color-coded syringes, and I hope that you'll try the Endo Sealer solvent for any cases that you're retreating where you know bioceramic cement was used for the seal.